can hear you.
Okay.
You as well.
Okay. Well, I would first like to welcome the attendees to what will be the final live event hosted by the Faculty of Philosophy during this month. And in today's webinar, we will be discussing the pandemic-related crisis, but from a psychological perspective. Joining me today are Professor Viviana Langher from the Department of Dynamic and Clinical Psychology at Sapienza University in Rome. Welcome, Viviana.
Hi, everyone.
And Professor Dinka Corkalo Biruski from the Department of Psychology at the University of Zagreb. Welcome, Dinka.
Hello, thank you very much.
We will each discuss 3 topics in 3 rounds. During that time, the attendees can pose questions in the chat section, and we will be answering these questions at the closing segment of the webinar. So let's begin with the first round. I would like to set the stage, so to speak, and would briefly address the possibility of defining pandemics and especially the current pandemic as a psychological phenomenon in a broader sense, since pandemics are primarily public health threats. However, in the absence of vaccination, the phase we're currently in, the so-called behavioral methods or protective behaviors that include hygienic practices, physical distancing. These are the first line interventions for the containment of the virus outbreak. So even when the measures and restrictions that health officials and governmental officials recommend or impose, even when they are appropriate and timely for each crisis point, their effectiveness is to a large extent determined by human behavior. So the attitudes, beliefs, cognitive processes that people use when assessing health risk, the resulting emotional reactions, primarily cognitive and affective biases, then the level of health literacy of the public, the individual differences and vulnerability to stress and coping competencies. For example, how people make meaning when facing adversity and uncertainty. And these are just few of the underlying psychological factors that can and do shape human behavior during a pandemic and during this one, certainly. So given that these, and I'm aware that I've named primarily individual psychological factors, but given that these factors are very strongly related to the socioeconomic and political determinants that affect population health, and including mental health, also neglecting them during the management of the pandemic increases the risk of disregarding or non-adherence of certain protective measures. And I think we have witnessed this in many countries, but also increases the risk of stigma and discrimination and the overburdening of the healthcare systems, even when there are primarily enough resources, and can also lead, and we will further witness this, to widespread and potentially long-term emotional distress in the population. So what I am actually asking, not so much stating, is whether we have to a certain degree neglected this underlying psychological component of the pandemics in many countries or regions of the world. And on that note, I would now invite Professor Corkalo Biruski to discuss how do people cope, or how have people coped at individual, social, and societal levels with such a change that goes beyond everything we have known so far.
Thank you so much, Katerina. These are very important issues that I will actually continue. Not. So the COVID-19 pandemic has exposed the global world to threats to individual well-being and the welfare of communities and societies in a way that was hardly foreseeable and imaginable not very long ago. So in fighting the virus, different countries have employed very different strategies with a single common component. And this is, and it shows itself in a full capacity. And this is actually a human behavior you started with, right? And the recent book on the psychology of COVID-19, authored by social psychologist Yolanda Yetten and her colleagues, made a very similar point. Many aspects of how communities and whole countries responded to the pandemic relied heavily on people's behavior. And this is exactly how the world actually has managed to cope with the crisis, by regulating human behavior. For example, by putting people in quarantine. So our freedom of movement was restricted, right? So by demanding to wear or not to wear the facial cover or the masks, right? So our freedom of how to present ourselves to others was regulated. By advising to shake or not to shake hands, by hugging or not to hugging people, including our family members, right? So our social habits actually were subjects of change. Moreover, the health and governing officials made very clear that it is in our hands. So meaning in hands of each and every hour of us to influence the pace and rhythm of the crisis, our behavior, or to be more exact, our changes in behavior has become the answer of the question how long the crisis will last and how we as a society will cope with fighting the crisis. And I would like to put stress on other aspects that was really heavily stressed, and this is responsibility. A notion of responsibility has become almost a buzzword in a public discourse, and many public campaigns use it in order to motivate people to comply with restrictions and impose constraints of behaviors. For example, here in Croatia, and we did very successfully or fairly successfully, I must say, our National Civil Protection Authority, who was in charge of managing the crisis, promoted quite a few slogans calling for responsible behavior and being very explicit about what responsible behavior look like. For example, be responsible. Let's keep us and our loved ones healthy. Or be responsible and show solidarity. Let's take care of each other. Or be responsible, stay at home. Or stay responsible, a danger is not over yet, and so on and so on. So quite a few or variety of slogans built around the issue of responsibility were used, and interpretations of what responsible behavior was. So it's really amazing that people indeed behave responsible, and in most countries supported very harsh measures that restricted their everyday behavior, which is, to be honest, not very often seen when we come to the health preventive behavior among human beings. So to conclude, the pandemic has shown that in situations when we don't have fast cure, when we don't have a vaccine, when we have to rely on practices that are not very different from what we knew even hundreds years ago when we fought earlier epidemics. So this pandemic has shown how important is to guide and manage human behavior. So a real star, I would say, in fighting the coronavirus pandemic has been human behavior and our psychological makeup, our capacity to react, our capacity to change swiftly, and our capacity to adapt and adjust to those changes.
Okay, thank you. Professor Langher, could psychology help in sustaining people in changing their habits from physical distancing to smart working to online didactic for children?
Well, I think that potentially psychology can help. Although I'm convinced that during this world crisis, psychology is a bit at risk I mean, a risk in supporting the dominant power. So we have to be careful because, of course, most of the decisions that regards human behavior, they are taken at the political level. And so it's very possible that psychologists are called and involved to support the line, every line of the local political level. So we have to be careful as professionals, I mean, because it's a very subtle line. And I think that we should consider very carefully the risk not to cross the line. Our task and our ethical task is to help people in reaching their own meaning or their own capacity of sense making about their own behavior. So we can help, but being careful who is asking for our support. In Italy, for example, we have a task force decided by the government where a psychologist, just one, was involved to study the current situation and to define some potential perspectives for the future. One of the questions was, how long could Italian people resist in lockdown? This is not a good question for a psychologist. I mean, so we have to be careful. On the other side, I listened very careful to what Dinka said before me. And of course, I agree that the biggest chance for us to face and to overcome this world crisis is to consider human behavior, because everything now depends on us. And so, yes, psychology can help during this process of making sense. People can accept to behave responsibly because they can understand why. I was very surprised during these weeks that people began again to believe, to have faith in what the scientists say, because you know that all over the world, in our academic position, we are often attacked like a group of powerful people manipulating data or manipulating the othher's minds. So I was very comforted in seeing that in this crisis, at least the people can refer to, globally speaking, to us as researchers, scientists, and so on. I think this is a good resource in the perspective to face and to overcome this crisis. And I think that really psychology can help in helping people to elaborate all the information that they can have, and to responsibly but also freely find their good sense in what they are listening to or reading.
Thank you. We can move now to the second round discussion points. What are the consequences for the mental and social health of people? Prof. Biruski, what would you say?
Well, we are not sure yet. We will definitely have an opportunity to see them and probably feel them very personally, and certainly to study them as a psychologist and social scientist. And it's true that we also are not very certain about mental health consequences so far. The current pandemic certainly showed an increase in worry and concerns, especially among people who were at risk of catching the disease. Or first of all, our elderly citizens, people with the compromised immune system, healthcare providers, and so on and so on. However, some recent studies done by my colleagues here at my department show an alleviated level of concerns and safety behaviors even among general population, and especially those segments in populations who are not at risk at all, for example, mothers with small children. Nevertheless, it seems that other factors besides, of course, objective vulnerability come to play when predicting mental health and social health outcomes. So the situation has been warned extraordinary, and people have been locked down for weeks and even for months. And even World Health Organization actually warned that we may expect an increase in various maladaptive reactions and behaviors, like alleviation of loneliness, depression, and even anxiety, harmful alcohol abuse, drug abuse, and especially family violence. At the more societal level, we have recently witnessed a rise of prejudice. First of all, towards Asian people, especially Chinese, being blamed for spreading the disease, or prejudice to migrants, linking them to the pandemics, or prejudice toward those who got infected and sick. And even more, in the beginning of the crisis, we also saw incidents of panic and completely irrational behaviors, such as buying enormous amounts of food, toilet papers, and so on and so on. However, on the bright side, these irrational incidents actually lasted for a relatively short period. However, I also think that people are amazingly resilient species. So in disentangling how this pandemic could influence our mental and social health, an important characteristic may be the key factor, and this is resilience. Capacity of an individual to bounce back from stress, recover successfully, and continue with a productive life. So we know that resilience as a bouncing back mechanism is, in the face of adversity, helps people to adapt, to adjust, to recover, to move on. And indeed, at the community level, not only at the individual level, we saw many elements of resilient communities. For example, many examples of community solidarity. To be very concrete, younger people who left their phone numbers and messages at the front door to their seniors, neighbors, to call them if they need anything to be done for them, to go to the stores, to pick up their groceries, to pick up their medicine in pharmacy, and so on and so on. People got organized to deliver food and other supplies for elderly, for those who live alone, for those who were under the measure of self-isolation because they were infected, and so on and so on. So to conclude, during pandemic, we have seen so many instances of helping behavior, human solidarity, and compassion that may give us a hope for the future, that we may become much better communities that we have used to be. What is challenging, of course, is to keep this level of social capital high, and this is something we should work on at all levels of our communities and the society.
Thank you. Professor Langher, are there maybe some positive effects on people's life due to the sudden changes in their routines?
I think that especially in Italy, I'm not sure that the situation is the same all over Europe, although I studied some the situation in several countries in Europe, and I think especially in Southern Europe, there is possibly a similar scenario. One of the weak points of our response to the pandemic is due to the weakness of the community medicine. Possibly because this pandemic took us by surprise, and possibly because community medicine became poor during the last decades. In this occasion, I think that the weakness of the community medicine was one of the main reasons why our hospitals were not sufficient. This was particularly tragic in Italy. I think that you know the situation, especially in northern Italy. But this situation pushed us to reconsider all the health system, and maybe we are now working in order to design a reform system which can manage this situation in the hypothesis that can happen again during next fall, or similar situation in the future. Having a better system to able to watch what's happening in the communities. I want to say that community medicine lost its main meaning to watch what's going on in the community. Now, a possible role for psychology. Yes, I am optimistic in this, because our main point is that it is the relationship between community and medicine, especially community medicine, that has to be renewed. For now, the situation is that a community doctor has a bureaucratic role. Just so, people go to him or her, ask for some exams or some specialistic visits in hospitals, and the community doctor signs paper. It's not enough. First, because if you have a general phenomenon like a pandemic, hospitals are not enough. So you cannot count on this system to face and to solve this kind of social phenomena. On the other side, it is very important that people become aware in the early stage of the problem, so that they don't have to rush to the hospital and to cure themselves. So especially in this relationship between the community, the people, and their medical doctors working in the community, we are called to fix the relationship and to support the change from a bureaucratic point of view to a productive point of view. I mean, the doctor is not a public officer who signs papers. Of course, he or she is, but it's not enough. A doctor is someone called to take care of your health. And so as a citizen, you have to count on him or her in this function, so that you can have better possibilities to take care of yourself. One of the practical solutions that I'm sure that in Italy are performed, but not only in Italy, because I read something similar in other countries, for example, in Germany, is that you can cure people at home. Of course, when the situation is not so severe, but if a medical system enter a private house, you have to manage the relationship. It's not that simple that a doctor enter a house and says, okay, you do this and this and this. It's not that simple. This relationship has to be managed. And so I think that a good community psychologist can help in smooth, in managing, in make this relationship more productive for the future, of course. Not now, not yet. I mean, for the future, yeah.
Okay, thank you. I would only like to add on, because you did cover all the major concerns regarding individual and community responses, psychological responses to the pandemic, but only to add on to the line of discussion regarding resilience. I think it's important to accentuate that most people can and will cope well, even during these times, and this is manifested. And that even milder adversities not only promote or build resilience, but can lead to growth and thriving. And I think that this is a component which should also be present, especially when mental health experts present their, let's say, concerns or worries about the mental health outcome. Of course, maybe not as in other public health spread situations, mental health care received a spotlight, especially in among governmental officials, international officials. And I think during this month, even the Secretary General of the UN spoke of implementing mental health care in general health care. However, I don't think that we should only focus on the negative outcomes, but also to accentuate the possibility of growth and thriving, even when facing adversity, but taking certainly into account the variety of people who faced in their countries. Mental health care systems collapsing or other resources not being available that can decrease the chance of these positive coping efforts. But generally, people have high capacity to cope. And I think this, even among psychologists, is not so accentuated as it should be. We should not only promote gloomy predictions about, I've heard messages that we should be awaiting an epidemic of mental disorders. Maybe not, but I think this is more of prediction that is not based on any empirical evidence, even past. We do have empirical findings from past pandemics or other global health threats. And I think we should be very careful when informing, warning, or terrifying to the public about what we might expect in the long term, not only in the short term. Okay. We can now move to the final round of discussion point. Again, Professor Corkalo Biruski, what would you say the consequences for our communities and social order as we know it?
I'm afraid there are more questions than answers.
Yes.
Well, there is a common belief that our post-COVID-19 society is never going to be the same. However, so far we don't have even a vague answer. What changes may we expect? How society is going to look like? What changes we may envision in the near and far future? And there has been only a few studies looking at the general social response to pandemics. And related to that, there are authors emphasizing that in our search for an efficient social response, we may want to look at social structures as a community healthcare system, as Viviana just told us about. So the social structures within the real world settings in order to find how to respond to pandemics as functional and efficient communities and societies. Therefore, in times to come, we will be confronted with this key question of what are the consequences for the social order as we know it. And although democratic societies or democratic regimes should be better equipped for dealing with the crisis, we have witnessed a relatively quick and efficient response of autocratic China. And not so responsive reactions of well-developed democracies like, for example, Italy or Spain, not even mention Great Britain or US, right? So if firm and top-down restrictions have been so efficient in combating the largest public health threat of modern time, then we should ask, could we expect people to be ready to give up on their individual choices and even rights at less threatening time, or in circumstances where the greatest threat would not be a virus, but rather economic hardship, massive unemployment, poverty, even differences in chances to recover between those who were rich and those who were poor, and the likely impairment of mental health of many people after surviving the corona crisis. So we should actually ask many questions about how our democracy will look like in a future. Or another question that I think it's very important, if digital technologies have been used so efficiently to track down and monitor individuals who break the norms, for example, those infected who leave actually mandatory self-isolation conditions, are people going to be more inclined to accept these measures even at a time when digital monitoring of citizens is clearly a gross violation of individual rights? So it's another dilemma. Or could we envision how social trust, both general trust and institutional trust in institutions, are going to be affected by our experiences of COVID-19 crisis? Are people going to be willing to engage themselves to cooperate with others, or to get back and fight for democracy? Or is the more authoritarian makeup of our society more feasible? So these are very important and very tricky questions. If this perspective of fighting pandemic is crucial or was crucial for how we actually cope as a societies and as a communities, is this perspective, if this perspective is so important, the crucial question is, and we should take into account very recent findings showing that the decline in citizens' level of satisfaction with democracy is very reactive and is connected to the presence of the objective critical events and social conditions like economic shock, like corruption presence, like policy crisis, and so on and so on. Moreover, there are studies showing that under conditions perceived as a huge threat, and the coronavirus crisis certainly is, the necessary balance of privacy rights and security concerns may be undermined while citizens show more willingness to accept less privacy, for example, as a trade-off against terrorism, in fighting the terrorism. And as far as I know, there has been no studies looking at the possible social changes caused by pandemics or other epidemic of infectious disease, and how citizens cope with them or imagine the changes that are going to happen, or we can foresee that there are about to happen. Therefore, in times to come, we may want to find out answers to those questions, so we could actually be better prepared for future challenges and for making some safeguards of how to preserve our communities and our democracy and society as being democratic.
Especially since we don't know when this pandemic will end and will it recur, and will this be a current state for a longer period of time?
Yeah.
In many countries, regions of the world. Yes. Thank you. Professor Langher, we spoke earlier about community psychology. Could community medicine, I'm sorry, could psychology help in promoting this new model of medicine?
Yeah, as I told before, I think that as experts of relationships, we can give a contribution in managing this new relationship between communities, between citizens and medical doctors that are necessary to improve the power, I mean, the effectiveness of community medicine. I think that to face this kind of phenomenon, we need a stronger community medicine. But it's not enough to refer to the classical traditional medical model, because as I told before, the medical model is based on the prescription. You need to do this, and you cannot do that, which is okay till people are frightened. I mean, like in this occasion. I want to thank Dinka also, because in this very careful list of dilemmas, I think that we really have to be aware that we have to pay attention to this huge question that she poses. I think that somehow it's very possible that we can get used to this new situation. Get used does not mean that we are becoming aware of what's going on, but simply we can get used. And so possibly in a while, like now, for example, we are reopening our activities. People are less scared of the virus and more scared of the economic crisis. And so the fear of the virus is somehow is weaker now. Can the medical model function in the same way in this new adaptation? I don't think so. I think that we need to be involved in the process to help people not to be frightened, because it's not the only condition, psychological condition that can allow people to accept some new behaviors, but to be aware of the necessity to have new behaviors. For example, the physical distancing, it's something really hard to accept, and it's very possible that we have to maintain this physical distance for a long time. But I want to say, I would like to add something. There is another kind of contribution that psychology can offer. We are really focused on the negative impact of the pandemic on the quality of life of people. And especially the lockdown is considered one of the most critical decision, especially, of course, at the political level, but for the consequences on the everyday life of every one of us. We can have a look at this global lockdown like a social experiment. In the social experiment, unexpectedly, we could observe some resources. For the so-called smart working. Now, I'm sure that we have to study very precisely a new organization of the work environment. I think that our current models are not enough, but we have to consider at least one thing. A lot of people forced to stay home and work from home, they felt a relief because especially if living in big cities, they did not have the need to run from one part to another, so they could have a better time, they could be more efficient at work, and they could have a good time with their own family. This is something that we should really consider, because most of them now are coming back to their old habits. I mean, going in their workplaces, and they are sad because they say that they are losing something, some kind of good quality of their life. On the other side, other people in this condition of so-called smart working, they felt alone, maybe because they didn't have a family, or maybe because the relationship within their family were not so good, and so the workplace was a place of relief. We should consider also this. I don't think that we have answers yet, but I think that we have the responsibility to study, to explore, to understand, and to offer new kind of solutions for work environments. The last thing about the school, the distance, the smart didactics. I don't know how to say correctly. This was a possibility for pupils not to lose their continuity in their training at school, but half of our pupils were cut off from this opportunity because the internet was not available in all families. The wireless was not so good quality, or families had possibly just one computer, so it was not enough for one computer to allow mom to work and the child to attend the lessons at school. So it's a good solution, but we have to adjust some very important details. The first one is the accessibility of the mean. I mean, the wireless. Yeah.
Okay, in a way, we were forced to explore other possibilities that we can now implement in this so-called new reality that we're all talking about.
I think that one of our problems as psychologists was to be emotionally focused on the mental health issues, which is important, of course, but it's also obvious that a lot of people would suffer about the fear, the lockdown, the economical crisis. But we are at risk of losing some good signs of resilience, for example, or new models that we should concur to analyze and then try to translate in practical solutions for the good quality of people's life.
As we should not be going back to the old reality. We should be moving now to an upgraded version, let's say, using that digital technological language. Improved version of our lives, and some people will certainly grieve this period and the opportunities that it brought them. Some people had closer social relations during this time, improved work-life balance. They had opportunities that they don't usually have, and they will miss probably these opportunities. Of course, other people who had restrictions pre-pandemic or unavailability of basic resources for, let's say, optimal quality of life, for them going back to the old reality will certainly be better, but one size doesn't fit all in anything. People react differently, cope differently, need different resources, and all our responses, both from the officials, both from the psychologists, should be tailored and specific for the needs and living circumstances of different groups of people or parts of the public. And in this closing segment, I would, in a sense, go back one step to, you spoke of the response, of the coping. I would like to go one step that precedes the both the public response, the official response to a pandemic, and that is the stage of preparedness, and whether psychology can provide some insight and inform and improve the preparedness for a next pandemic or for the next wave that we might expect. I have reviewed some past research from health psychology, although there are dozens, maybe hundreds of studies carried out right now, and we will have certainly rich empirical literature on this pandemic, but we also have rich empirical data from other studies relating to serious public health threats. And we know that a very crucial part of how human behavior is shaped is how health communication is conveyed, or how risk communication is conveyed. And people differ, as in everything else, in the way they search for information, how they perceive, interpret information. So communicating health risks or attempts to promote protective behavior should also be tailor-made and specific to the individual needs or the social needs that people have. Usually, health information is communicated in a form of a fear appeal. People are informed how high the threat is and what they should do about it. But research has shown that if people don't perceive their subjective efficacy is high, when the threat is high, they will, at the same time, they will not adhere to the recommended behavior. And in that sense, it is not enough only to fear people of the, let's say, gloomy future of the negative outcomes, but there should be possibilities for them to practice this behavior or to feel and experience that they're efficient enough. Or some colleagues have said that each and every one of us are actually first responders. We are the ones who respond first to the crisis. As Professor Corkalo Biruski spoke of responsibility. So we are, in a sense, the first responders, and if we feel efficient enough, we will be more inclined to adhere to the recommended protective behavior or any other form of behavioral method that would contain the virus outbreak. But until people feel efficient enough, they will only be fearful, and they will worry, and they will probably be indecisive. We should, in that sense, typically regard people not as passive victims of what is happening to them. They're not only experiencing the consequences of the pandemic, but they are also construing the meaning of this experience. There are some of them, as Professor Langher spoke, are in the process of benefits finding. And I think if we move from the negative rhetoric of the virus being our enemy, even using military language, the virus being the invisible enemy that we are fighting against. If we move from that rhetoric, I think that if we empower people, we will probably see better outcomes, and that could result in better mental health outcomes. So let's see if we have, okay, I think that we might have questions. So we have an opinion here. Okay, and let me see if we have, yes, we have two questions. One of them is, what are your perceptions towards quality education as a consequence of COVID-19? And what could be some immediate action to undertake in the university that could reduce its negative impact from the psychological point of view? Would you also recommend to have psychologists available to deal with various students' difficulties when the situation improves a bit? Whoever would like to answer.
Oh, Katerina, I'm really sorry, but the quality of the audio is very poor. You see, one
Very
of the
low.
problem. No, I think it's my fault, but I wasn't unable.
You weren't able to.
Unable to
Okay.
understand the question. I'm really sorry.
I will read it again. Okay.
Thank you.
So, what are the perceptions towards quality education as a consequence of COVID-19? And what could be some immediate actions to undertake in university that could reduce its negative impact from the psychological point of view? Would you also recommend to have a psychologist available to deal with various students' difficulties when the situation improves a bit?
Who's going to start?
Whoever wants to start. Okay.
I suppose the question is for everybody, right?
Yes, the question is for everybody.
Okay, let me quickly try to respond, actually.
Okay.
Many students actually, I'm talking from the perspective of the university students. So different students responded, of course, differently, but I would say most of them coped with the situation far better than we from the others, from this side of the screen were. So our students were fairly good equipped. They were able to follow our instructions, our lectures. In my school, we had a tremendous group of people, engineers, IT technology experts, who actually helped us amazingly to deal with the situation, to set up the system for giving the lectures, for consultations, for exams, and so on and so on. So this is one part. Here in Zagreb, we did have another major stressor, and that was the earthquake. And this is actually something that made the mental health of our students, that affected the mental health of our students much more than the situation with COVID itself. And how we reacted was actually to establish a phone counseling for our students. So our colleagues from the department and other colleagues from the school actually established this kind of counseling for those in need. And this service actually functioned quite well. However, I would like to say something from the side of a teacher. I became aware how, of course, I knew that before, but in this particular situation, it was so obvious that the lecturing and teaching and learning is a social situation par excellence. It's a social situation first and foremost. And yes, I did my lecturing, I did have my classes, and I communicate with students and so on and so on. However, what I miss was to see the faces of my students when I talk to them. And that was really something that I miss. And I think that we should keep in mind that the learning situation is a social situation first and foremost, and to keep this aspect very appreciated when we actually come back to our classrooms.
Yeah. Yeah, I really agree with Dinka, especially with this last focus on social situation or affective bond, because there is this good emotion, good affection passing from the teacher to the students when we are in the same place and attending, every one of us attending a lecture. I talk and I listen, they talk and I listen to them. And so we had a very strange reaction at the beginning in my university, because immediately there was this slogan, Sapienza is not going to stop. But it was a manic reaction. How? It's not going to stop, please. We have to adapt, we have to settle new systems, we have to understand how to communicate with students, how to continue to do the lessons, and every one of us had to remodulate the program of the content of the lessons, because they were not suitable for the online lectures. For example, I used to be a very interactive person in the classroom, so I invited every one of our students to express their opinion, which is not it's impossible to do with the online platform and in this distance learning. So Sapienza is not going to stop, but it had to stop, or at least to slow down the rhythm. And after the first moment, this manic reaction, we became a bit depressed, especially the students. Also us, I mean, of course, and this is the reason why I agree with Dinka. We missed the social situation and the affective bond with our students. But also the students, they were lost in a way. They just waited for some kind of signs from us, just to tell them that not only we were available to continue our lectures, but to be present in their lives. So the lack of social contact was really hurting, I mean. And also in the other level of the educational system, I heard several parents complaining about their small children who were missing their classmates. They were okay, they had possibly a good internet signal at home, a proper PC, they could attend the lectures, but they still missed the physical contact with their classmates. And now that we are reopening our situation, but the child, we are not obliged to wear the mask, the facial mask, when in the open spaces, but in a way we are suggested to do. And so you can see the small children that have to play with their mates wearing the mask. And I think, okay, they are able, of course, they are coping very well with this, but it's something that I'm not used to personally, I'm not used to see and not to react emotionally to this. Yeah, they are losing something. Of course, they can adapt to this new situation, but I'm sorry, because I think that they are losing the expression, for example. I cannot wear the sunglasses, because with the mask, with the sunglasses, no one can understand what I am communicating. So.
But of course, it will be a gradual process of adaptation. The changes were so abrupt, and every domain of life was discontinued, and we pretended that we can continue doing everything else the same when nothing was the same.
Yeah.
So, but okay, we had 2 or 3 months, and I think that we gradually adapted. And these experiences, I believe, should be implemented in our further educational processes. We should not forget the digital component of education, since it doesn't have to be the primary channel of education, but it can certainly upgrade the quality of the educational system. We have a few more questions, but our time is gone. We had a 1 hour time slot, so we will have to finish. I would like to thank both panelists. I would like to thank the attendees for being with us. And I hope we will meet again. After the pandemic, during the pandemic, we will see what opportunities we will have in the future. Thank you.
Thank you, you too.
Thank you very much.
Thank you.